Infectious diseases are just boring. So I also didn't want to make it so long that you guys were all sound asleep before I got to the end of it. So these are basically things that we see in dogs and cats, and a lot of it's focused on what we see here at the shelter, or what we vaccinate against. So it's not an all-inclusive, that's a book about this thick, with really tiny print. So what we'll talk about are basically parasites, both internal and external parasites, viral infections, bacterial infections, and a couple fungal infections. That kind of covers pretty inclusive of the major infectious conditions. So we'll start with the parasites because that's what we see the most of. And we'll kind of cover fleas, ticks, and mites, and then we'll get to the intestinal parasites and a little bit about heartworms as well. Once again, this is not all-inclusive because there are parasites that get into the bloodstream. There are some that get to the lungs, so there are some weird things out there. And there are some other intestinal parasites that we don't see that frequently. But when we ruled out all of these and we still have issues, we go looking for those weird little ones. So here's our little friend, the flea. This specifically is a cat flea. He's got a little mustache, a little bit of a mullet there. The scientific name is Tennicephalites felis. I get my little cheat sheet here. On our life cycle, it seems very simple: egg to larvae to adults. But the adult can live out an average 6 to 12 months, up to 2 years, and that you can have a house guest for 2 years. The female can lay anywhere from 3 to 25 eggs a day during her lifetime. Okay, so that's how we end up with flea infestations. The eggs hatch in 2 to 14 days, depending on the species of the flea. The larval stage is 10 to 21 days. They like to avoid light, so they're usually around crevices, underneath furniture. And this is really important to remember when it comes to how to get rid of them in your household, or when you're telling somebody else how to get rid of them in their household. They actually don't like light. Sometimes at larval stage, if there's not enough food in the environment for them, they can basically go into this little hibernation phase that can last for like 200 days. And that's why you hear those stories of people who moved out of an apartment that's been empty, or a house that's been empty for several months, looked clean, walked in, and all of a sudden the fleas went crazy. Like within a few weeks of moving in, you realize there's a flea infestation. Well, those larvae were just waiting for food to come into the household, okay? And that's why you ended up, you didn't see them initially, but then they were there. Those larvae do form a little cocoon, which we don't really see. It just looks like a little fluff on our floors or in the crevices. And then it pupates into the adult at 7 to 14 days. So that whole life cycle is about 30 days, which goes why we need to, when you're trying to get rid of an infestation, you have to continue to treat for 3 months to make sure that you get rid of them. So you have to make sure the pets are all treated for 3 months consistently, the home is treated, and for that time frame. So because that's just, once again, how long they're going to live. So the host, once again, for what we really deal with, cats, dogs, people, but really there's a flea out there for every species. And a lot of them have their preferred hosts. So the cat flea likes cats and dogs. They don't like people as well. That will be an opportunistic meal if need be. And then there's the ones like for mice and that type of stuff that actually can spread plague. So that particular flea. They are the intermediate host for tapeworms. And once again, I just listed some of the things that they can spread. The ones we would be concerned about, Bartonella and the hemotrophic mycoplasma. We don't see plague in this area, thankfully, but out west they do. And tularemia we can see in this area, we just don't see that much of it. It's actually a bacterial infection in rabbits. And so cats killing rabbits can potentially get exposed to tularemia and then expose you to tularemia. It is a zoonotic condition. So, any questions on fleas? Ticks. They are divided into two major groups, hard ticks and soft ticks. And there's a whole bunch of them out there. So I listed approximately 25 species of soft ticks, 55 of the hard ticks, but only about 16 of them basically will feed on domestic animals, and even a smaller number as far as really dogs and cats. So it says domestic animals, we're also looking at livestock that have a higher tick burden sometimes. So life stages, that's what this little thing is. So once again, we've got the eggs, the larvae, nymph stages, which depending on the tick, they may have anywhere from 2 nymph stages to 3 or 4. And all they do is they're just kind of getting bigger as they go through those stages. And then they differentiate to male and females. And those are the largest ones. Those are usually the ones that we find feeding on dogs and cats, although sometimes we will find the nymphs as well. All life stages take a blood meal before they kind of molt and move on to the next stage. And they also, definitely the nymphs and adults can transmit diseases during those meals. Okay, so the things that we get concerned about, Lyme, Ehrlichia, anaplasmosis, Rocky Mountain spotted fever, Bartonella. There are some others, once again, not as common in this area, but if you go spend part of your winter in the south, so Florida, the Carolinas, they have more tick-borne diseases than we do. If you want to travel and you spend time up in Michigan, there may be a different set up there. East Coast versus West Coast basically, there's various different conditions or diseases that are spread by ticks. If you're going to an area with a pet in a high tick region, using both the oral tick preventions as well as a topical is your best bet. If you're just here, kind of in the Boone County area, Zionsville, for the most part, either one of them, but definitely the oral ones will be sufficient. So the 3 ticks that we see the most, American dog tick is dermacenter. It's the pretty one up there. The deer tick is the tiniest one. It's the one that's really hard to see. And the nymphs are even smaller than this. So they could be about the size of a pinhead. But yet they can take a blood meal. They can still transmit diseases. There are Lyme vector for the majority. And then the American, or the brown dog tick, sorry. I just like the rhipicephalus name on that one, but it is the primary one on dogs. And all life stages will be found pretty much on the dog. So, like I said, treatment, prevention, so this is both for fleas and ticks, is the good prevention. The oral ones are the most, they're the newer, they're the ones that don't have any known resistance to at this point in time. A lot of the topicals do have some resistance, so once again, if you're in a high area, then you want to have that double safety factor. And definitely any dog or cat that has flea bite allergy, then the oral may not be your best choice, because to get killed, they have to take a bite. And so the topicals may be your choice in that instance. For cats, we do have the topical Revolution Plus and NexGard combo. Those two both are the top of the line for fleas, ticks, also protect against heartworm, and some intestinal parasites as well. So, not that I'm selling anything for anybody, but just so you know what products are doing what. And if you are a Bravecto user, keep in mind the 3-month is for fleas only, not for ticks. The label is only for 1 month on ticks. So once again, if you're going to a high tick location, you want something else in there as well. So, all right, now we get into the other fun that we can't see with our eye.
Can I ask a question? I'm afraid I'll forget it if I'll wait.
No, you're fine.
When the drugs that are, like, they work because they're in the bloodstream, right? What kind of, do you think those are shortening, like, liver damage or anything? Is there anything like that from?
Nothing that's been, once again, at least at Zionsville Animal Hospital, we do a lot of blood work and recommend a lot of annual preventative care, maintenance type following trends. So no, we don't see any increase in like liver values, kidney values, and that hasn't been identified with those products. The biggest thing is neurologic. And not that they will cause seizures, okay, they don't affect, but if a dog is already prone to seizures, these products, the oral products, okay, can lower the seizure threshold and make it more likely that they will seizure, okay? And so we don't recommend the oral products for dogs that have a known seizure history, or maybe that after being on them, they have that seizure, we'll pull them off and say, let's use a different product. Just for that, like I said, it doesn't cause them, but it will lower that threshold, okay? And that's why a lot of breeders will have in their little contracts that say no oral flea or tick products for the first year of their life, because that's how long the warranty is. Yeah, so they don't want anything coming up. So, any other questions? That's a good question. Okay, so these are the mites, and these are the ones you can't usually see with the naked eye. You need a microscope. So Sarcoptes, that is the quote mange mite. This is a zoonotic, and I'll say it's zoonotic. It's a little hard to get it directly from the dog or the cat, but the fact that you share an environment and they picked it up from the environment means that you could also be exposed. What a lot of people will actually have an allergic reaction because their dog has Sarcoptes, and they'll be really itchy. And so I've had clients who were like, I got diagnosed, I went because I was really itchy, I had these lesions, I went to my doctor or my dermatologist, they diagnosed me with, and so I'm here to get my dog who's totally asymptomatic checked out. And we're like, okay, guess what, we're just gonna treat. So Sarcoptes is hard to find, okay? But on a dog, you guys recognize this is Mark, okay? At one of his worst stages. Extremely itchy. So this is a dog that may be when we talk about itch, we look at a scale of 1 to 10, with 1 just being that, kind of, hey, just today I'm just scratching a little, to 10 being I can't sleep, I can't eat because I'm constantly itchy, okay? And so these guys were that 8, 9, and 10. They're extremely itchy. A lot of times the lesions are they only have a couple spots where they have lesions, but they are just itchy. Their skin will be red, angry, they'll have some thickened areas that are probably scabby from where they've been itching. And that's sometimes where you find them. But you can basically do a skin scraping on an entire dog and still come up negative. Because there may only be 1 mite on that entire dog, and they're that itchy, okay? So very rarely do we see Sarcoptes on cats. They can get it, but very rarely. And then once again, transiently on humans, they just don't like us. We're not very good. notoetries, that's the mange mite of cats, so kind of the same thing for sarcoptes, except for the cat. Usually they're, once again, very itchy. Lesions are usually up around the head and neck. And the way they usually get this, and this is also the mite that you see those, the foxes, the mangy foxes, that's sarcoptes, okay? And so these guys get in direct contact either with another animal that has it, or more commonly, they're rubbing up against something that a fox rubbed on. And so the fox has come along, he's rubbed on the shed or rubbed on the fence post, and the dog smells it and says, I gotta rub on this too. And the next thing you know, the dog's got mange, okay? So that's kind of those. Like I said, we don't see it that much in cats. Demodex, this is actually a commensal organism of the dog. So that means it normally lives on the dog. And the dog's immune system keeps it in check. It lives way down in the hair follicle. You can't see it. There's very few numbers on most dogs. These guys get it. It's mom has it, they nurse from mom, and it goes over to the puppies. And so, which is why because puppies are immunosuppressed, we're more likely to see it on puppies. Okay, so those hairless wonders, that's usually Demodex. And it does cause itching, it does cause redness, but nowhere near the level of the sarcoptes. A lot of times, once again, it's that hairless dog. It's the one that you're looking at, which actually is kind of what I suspected with Mark here. Part of it is he's a pit bull, and pit bulls seem to be really prone to Demodex. Their immune systems a lot. And so usually legs, face, neck, sometimes abdomen. Like I said, some dogs will just have it generalized everywhere, and they're just losing individual hairs. And that's because the mite is reproducing in that hair follicle, and there's just not enough room. And so out goes the hair, and they're there.
I have a question. Do the local coyote seem to be prone to this?
They probably do as well, but the foxes seem to be the ones that really like sarcoptes. Like they just seem to, like their immune system can't control it. And you see those really mangy foxes. And you'll even see the pictures of them because they're just so itchy, they can't hunt. They don't feel good, and so they end up getting really debilitated by them. But it could happen to coyotes as well, any of the canines.
We have a lot of coyote in our neighborhood.
Okay, yeah, so yeah, it could. You just don't see too many of them, actually, the mangy coyote. But if you saw one running around without a whole lot of hair, you had to be concerned about sarcoptes. So here's our little friends down here in the corner. So the others, Otodectes, ear mites. They're always fun to find on the, kind of swap the ear, look under the microscope, and there they are. And they can affect cats, dogs, and ferrets. Once again, usually close contact. So if I have a dog that has ear mites, I usually ask, hey, do you have any cats in the household? Because they really love cats. And yeah, we do. Okay, well, we gotta treat your cat as well as treating the dog. Okay. The ferrets can get them as well. The Cayetilla, it's a hard one to say. Walking dandruff, we can see that on dogs and cats. Once again, usually it's more common in pocket pets. So the rabbits, the guinea pigs, chinchillas, hamsters, those type of animals. So if I find that on a dog or a cat, I usually turn around and ask, do you have a rabbit in your household? Or any of these. And by the way, are they itchy? Because that's usually where they're coming from. Yeah. And just like it says, walking dandruff, they look like little white flakes, and sometimes you can't actually see them move within the coat. So I know now you guys are all like, oh, my cat's got flakes. To diagnose them, like I said, for Sarcoptes and Demodex, so this little guy here and this one here, so like I said, it looks like an hair follicle. The skin scrapings, Sarcoptes really hard to find, Demodex easy, we just kind of squeeze the skin and scrape it and they come right up. For the other two, we do tape preps, where we literally just take a piece of tape and go like this on the dog or cat, and then put it on a microscope slide and go look at it. And that's how we also find lice. So once again, I didn't go through it because we don't see it that frequently, but dogs and cats can get lice. Found it on a puppy not too long ago. So and then for ear mites, like I said already, ear swabs, and looking under the microscope. So which pretty much all of them, you have to look under the microscope to truly see them. The treatment, once again, our newer products for fleas and ticks kill these, which is great, especially for Sarcoptes and Demodex, because you used to have to, you would go home with a bottle of ivermectin, that every day you would have to pull up a certain amount and give it by mouth, or give it as an injection. So now you just give them a once a month tablet, and things get a lot better. So yeah, I kind of like it from that aspect. It's made treating all of these other parasites a lot easier. And once again, with the, especially with Demodex, they'd have to come in every 3 weeks, and we'd have to skin scrape again, count the number of little Demodex mites to make sure that we were making success, and continue until we got down to a certain number. With the newer products, I don't have to do that anymore, and owners don't have to do that. Dogs don't have to go through that anymore. So, and that's all off-label use too. All right, any questions?
So the preventatives are the same as the treatment, right? Okay.
Yeah. So, yeah, makes it kind of a, yeah, no, like I said, some of these things we just don't see them like we used to. Or once again, we can control them, get them treated a lot faster. So even when we do have a suspicion here in clinic, once again, we already know, yep, we're going to be treating it. So, okay. All right, intestinal parasites or internal parasites. These are basically they infect both dogs and cats. There's a couple in here that have a preference for only dogs or for only cats. Pretty much all of them are spread what we call fecal-oral. So that means dog or cats walking around, licking their paws, and they get infected. But also some of them can be spread across the uterus, as far as across the placenta, and also through the milk. So some of them are more common, which is why all puppies, unless mom has been dewormed and is clear, puppies or kittens are probably going to be born with intestinal parasites. So they also go through some different life stages in order to be infective. And some of them have to go through another host before you're infected. Once they're back into the dog or cat, they have to migrate through. So they might migrate through the lungs, they might migrate through the liver, through other organs before they finally make it back into the intestine to set up shop and start reproducing. The reason I say that is that has to do with treatment. Okay? When they are out in the tissues, we can't get to them. Okay? So you can have a negative fecal, and then a week or two later have a positive fecal. Okay? Because they were in transition, they weren't there. Okay? Sorry, you guys, dry throat. So, but average life cycle, 2 to 4 weeks, because once again, that's that time frame. So hopefully these show up pretty good on your handouts. I was gonna go through, and I was like, oh, I've got this book that has these cute little pictures. So I just took photographs of the pages, okay? So roundworms, Toxicara or Toxac ascaris are the species. And when you're looking at these, so once again, it has the dog, but up in the corner, it's got the little kitty cat, so it infects both of them. And you can see that they're here in the intestines, and the eggs get pooped out. They go through a little life change, and then they've got two routes of getting infected. So the dog can walk across and pick this up on their foot and basically ingest it, and it sets up shop. Or this little mouse here could ingest it, and then the dog eats the mouse. Which same thing for the cat is more likely, once again, there. And then here also we have, it can go straight to the puppy from mom, either through the placenta or through the milk. Okay? And that goes the same for the cats. So our treatments, these are usually pretty easy to get rid of. These dewormers have been around for a long time. Pyrantel is the one that we use here at the clinic most frequently, and it's pretty effective. Fenbendazole is another one that we could use. And then I listed ivermectin just because that's the one that the ivermectin or its relatives are the ones that are in the heartworm prevention. Okay, and so every month that you give your dog heartworm prevention, you're actually deworming against roundworms and hookworms. Okay, all right. So then hookworms, very similar to the roundworm, but this is one that when they poop them out, you usually don't see them. Roundworms are the ones that Dawn and Christy get pictures of. The cats are usually throwing them up, dogs are pooping them out. So there's the different scientific names of the different ones that infect dogs and cats. And same thing, once again, sets up shop in the small intestine. They poop out these wonderful eggs. And then these are pretty much directly infective. So they go through and they develop this larvae that can actually penetrate the skin. And so if it's an area that's a highly contaminated, so once again, some kennels, environments, where there's a high number of dogs and stuff, then these can be basically out there in the soil, and as dogs are walking around or laying, they can actually get infected, and as well as they can ingest them. This is one that they can hang out in the tissues for a long time. And we would see this most with greyhounds because once again, the tracks and how much the dogs were moving around. They were always in kennels. There was a lot of movement of dogs in and out of kennels. So dogs coming off the racetrack were heavily infested or infected with hookworms. And it would take sometimes 6 months or more to clear the infections because they would be so much into the tissues and they would just be hanging out there waiting. And then you'd clear out what was in the intestine and the next group would move in. And they'd clear them out, next group moves in. And so this is another reason why sometimes it can be frustrating because you're like, oh my God, we just, we had a negative and now we got another positive. Because sometimes they can hang out for a long time, and it's not until we get them all into the intestinal tract that we kill them or we get rid of them. Okay, and that's why if your veterinarian says, hey, we need to see another fecal sample in a couple weeks after deworming, yeah, this is why, because we want to make sure we get them. That we've broken the cycle.
Dr. Rader, I read in a DVM manual back in the 70s that, and I was thinking when you said that, these drugs have stood the test of time because that's what everybody was using back then. But I read that hookworms make the stools look mucousy and sometimes you can see blood. Is that?
Sometimes they can have diarrhea, sometimes they're just totally, I would say the vast majority of the time, asymptomatic.
Really?
Okay, which is why these keep getting into the environment because the stools look normal, so we're not worried about it. And we don't take it in, and then all of a sudden, oh, there it is. Okay. once again, heartworm preventions do get rid of this, and so every month, you are basically deworming your dog for hooks and roundworms. But once again, if we have those dogs that we have that persistent, we may start doing like heartworm prevention is here, you're gonna do a dewormer 2 weeks later, heartworm prevention 2 weeks later, and so that every 2 weeks, so that we're catching that 2 to 4 week time frame to clear them out. And I've had to do that for a long time with some greyhounds. Every now and then we'll get a dog who's, same thing, they came from a high density area, and we have to work a little harder to get them cleared. So there is something out there about maybe hookworms getting resistant to like pyrantel. Same thing, it's usually those high density. Sentinel is one of the ones that still seems to be pretty, as far as heartworm prevention, that also seems to be pretty effective here. Okay, this is one that's dog only, no little kitty in the corner. So whipworms, we don't see it that frequently, but it is out there. This one can cause a lot of diarrhea, and actually it's one I get concerned about when a dog's been having diarrhea and weight loss, because dogs can get really thin when they have this. So before I start doing a huge workup, that's the first thing. I want a stool sample, bring it in. This is also the one that most of the heartworm preventions don't get. Sentinel and probably Interceptor are the only two that do. Okay. So same kind of life cycle, adults in the intestinal tract, eggs get pooped out, they go through their little life change, and then they get picked up on the paws and the dog gets reinfected, or the next dog coming along gets infected. So this one, when it comes to treating, we primarily use fenbendazole, so Panicure, and it's got basically what we call 3, 3, and 3. So you treat it for 3 days, you repeat those 3 days in 3 weeks, and you repeat it again those 3 days in 3 months. And it's really important that you get all of those, otherwise you might still be dealing with this. And some of that goes back to the environment being contaminated and that life cycle as far as in the tissues and that type of stuff.
So is the rescue that we're using in the kennels frequently, especially when a dog comes back out, is it killing all of these ones that are environmental?
So in the kennel, a lot of them are probably, it's the yard that's not. There's no way you can clean that yard and disinfect the yard. So, or pretty much the salad boards. I mean, you can't, salad boards are a little bit better because once again, with the artificial turf, they don't have as much organic material, but you think of the mud that comes in off of the yard into the salad board. Now you've got organic material within that artificial turf, and now you've got a place for these eggs to live and the next dog can come along and get them. So, yeah. That's why, once again, clinic, we try to deworm and deworm and deworm and deworm a lot. So, and like I said, a lot of the heartworm preventions, like I said, not so much on whipworms, but on the others at least. So, tapeworms. So this is one we get a lot of phone calls on. Once again, Dawn and Christy get a lot of photographs about. So, and a lot of concern about, can I get this from my dog or cat, okay, or from the foster that I have? So the answer is no, you can't get it, okay? So this is one that it has a very specific life cycle, okay? It has to go through an intermediate host. No questions, nothing about it, has to go through an intermediate host. And they're also pretty specific. They really prefer their dogs or the cats and that type of stuff. So on the 2 different forms, Diplydium and Tinea, the Diplydium is our flea tapeworm, okay? So it has to go through, so those little things that they're pooping out, those are egg packets. And so there's a couple hundred eggs in that little segment. And those kind of dry up, and the flea comes along, that larvae or that adult flea comes along and eats that packet or eats the eggs. and then it goes through a life cycle in that flea, and then the dog or cat's grooming themselves and they ingest the flea. And then the tapeworm can basically set up shop in the dog or cat. So that's probably one we deal with the most because we'll get in a lot of dogs and cats that have fleas. And so we kind of know to watch for it. Our standard dewormers like the Drontal, or not the Drontal, sorry, like the Pyrantel and those sort of things don't get at the flea and tick, and the heartworm for the most part don't get rid of this with the exception of NexGard combo. For cats, will take care of tapeworm. So I like it for that reason. It's kind of expensive. So the tinea, same thing. It has to go through a host, and this one, the host is a small critter, usually a little rodent. So same thing. They basically somehow ingested that egg packet or the eggs in something that they ate off the ground, and then the cat catches and kills and eats the little rodent. Can happen in dogs as well, for those dogs who like to hunt them. But we see this one probably a little bit more in cats just because they're usually the hunters. So the treatment is praziquantel, and so it's still been very effective. The trade names Droncit. Drontal is one that has praziquantel plus pyrantel and fenbendazole in it. So yeah, pretty easy to get rid of. But yeah, you guys can't get it, nobody, so, unless you ate the flea. I know. Yeah, so Giardia, we see this a fair amount, okay? Definitely we go looking for it a lot in puppies and kittens and dogs that have diarrhea. It's not always easy to detect, and a lot of times we'll get false negatives. Now there's newer testing, ELISA testing that's actually looking for the genetic material. So we can sometimes get a positive, and even when they don't see or detect the actual eggs or the little organisms. But still, you can only kind of run that one time because it'll stay positive for months after successful treatment. So it's, just because if you tested and you got a ELISA positive Giardia, you treated, when you retest, you don't want to do the ELISA again because you know it's still going to be positive. You're kind of relying on them. Do they see the cysts or do they see these are the trophozoites? So yeah, at least 3 different species of Giardia, probably more. Giardia duodenalis is the one that infects mammals. This comes and goes as far as on the zoonotic. So there are those out there who are strong believers that this is zoonotic and that if your dog or cat has it, that you can get it. There are others who are like, this really doesn't like people, and that you really have to work at getting it, and probably the reason that you might have it is because you share the environment, so therefore you're drinking the same, from the same water faucet, or you guys all went camping at the same location, that you all got infected from the same location. And I have had that with a client who brought their dog in for diarrhea. We went through talking and actually did see under the microscope, diagnosed Giardia, was talking to them, and they were like, can people get that? And I was like, yeah. They're like, yeah, we were all camping at a cottage or at a cabin, kind of rustic, and we all, were drinking. They had basically, there's a well system, and they're like, we all have diarrhea. And they're like, we didn't know why, like the dog and all of us. And it's like, yeah, talk with your doctor to see what you need to do. And yeah, because the well was probably contaminated, and that happens with well water. Some municipalities, especially with older water systems, water treatment systems, can get Giardia into the water system and there can be an outbreak in a community. Once again, a lot of the communities have had to upgrade for a lot of different reasons, so we don't see it as much. But that could be like it came through your faucet. Family got sick, dog got sick, you're all drinking the same water. Okay?
So can you talk a little more about that? Like I was fostering Trudy and she was symptom-free. But when she got adopted, the first vet visit that they took her to, she tested positive. So I figured, well, she must have had it when she was here. This was before we were treating everybody when they first came in. So I treated all my dogs with manicure, make sure I was cleaning up the yard and all of that, but everybody had been symptom-free.
Yep.
So is there more as a foster that I should be doing to make sure?
Not really, because you can randomly, and this has been done, randomly go out and have people bring in stool samples, fresh stool samples, and test them, and a high percentage of them will probably test positive for Giardia in totally asymptomatic dogs, okay? So there's also a big thought process of just because you see it in the poop doesn't mean there's an infection. And same thing, dogs are picking things up off the ground. There are a lot of peoples that we get back that say, we saw da-da-da-da-da, not a parasite of this species. Hey, it's your horse. And so, which sometimes we do, if they specifically say, oh, this is a horse parasite or a cattle or sheep or something, and we'll be like, do you guys have? And I'm like, yeah, well, maybe you want to deworm them because your dog tested positive. Dog's fine. Yeah, so that can happen with Giardia. Okay, we know that it will go through, they'll be asymptomatic. It doesn't necessarily always colonize the intestinal tract. And so, yeah, you have to, for some, if I have a dog with normal stool and I get back a positive Giardia, a lot of times I'll talk with the owner. Okay, well, this is the first time. Maybe we can go ahead and treat and see if we can get a negative, okay? If we get a couple negatives, great, we don't worry about it. But if we're on the third fecal sample, dog's still asymptomatic and I'm still getting a low number of Giardia, I'm probably gonna stop treating, okay? And let their immune system fight it off. Because that's really how it's, the body has learned to deal with this parasite, okay? When we see it is during stress. That's when it can get a foothold. So once again, yes, we might see it more here or in dogs in transition. So when that foster dog goes to the new home and diets get changed and there's new snacks and, then once again, now we're through a time of stress. Now maybe it did get a foothold and they've become symptomatic, okay? But you can't prevent it. It's just that much out in the environment, okay? And yes, the cysts can live a very long time. That's the egg form. They're very resistant in the environment. They can survive the winter. They can, because they're little tiny cysts, they don't dry out very well. So they can live through a drought. So they're out there. There's, once again, wildlife. So yeah, we can't avoid it. We just have to accept it. And when they're symptomatic, we treat. Okay. So best thing, I said, is this infective, asymptomatic shutters, there we go. Thorough cleaning and disinfecting, preventing fecal contamination of food and water. So once again, in our play yards, yes, I know, we throw a lot of food out there for dogs to go find. And yes, it is a route to get infected with parasites by doing that. But we just have to weigh the odds. Okay, this is environmental, we've got to give them something to do and know that there's a slight risk to it. Hopefully their immune systems are solid and they're going to fight it off, okay? Fiber in the diet, very beneficial in helping to decrease Giardia from getting a foothold, as well as helping the body clear it. Giardia does not like fiber. And so it can't digest it can't use it as a nutrient source, but the good bacteria in our body can. And so it really helps just that competition of promoting the good bacteria that then say, hey, sorry, Giardia, you just can't come to this little spot. And so then the Giardia just passes on through. Okay, so That's why a lot of people see us say, okay, we're adding fiber to this dog. We're helping them out. Any other questions on Giardia? So coccidia, we see this more in cats, but dogs can get it as well. And so this also kind of two cycles basically, where it can go through a little critter and cats can get infected, as well as just directly from off the ground or the environment. Yes, dogs are great at passing. These show up all the time. There's one that's called Ineria, and it's basically the coccidia for birds. And so, especially like geese, those sort of things. So we'll get all the time that Ineria on a fecal, and it's like, yeah, not a parasite of the species, goes through birds. So, and then they get diarrhea primarily. This one is actually a little harsh on the body. In order for those eggs to be released, this one actually gets into the cells. So Giardia kind of attaches to the cell, okay? Coccidia invades the cell, okay? And it replicates, and then in order to spread, it has to kind of burst out of that cell, so it damages that cell, and then reinfects the ones on this next to it, and so and so and so. And so we actually end up with the lining of the intestinal tract being pretty unhappy with coccidia. And so that's why the diarrhea sometimes is more severe, especially when we have these little tiny kittens with it, or puppies. And the diarrhea lasts a lot longer, including after treatment, because that intestine has to heal after we get rid of them.
Dr. Rader, does the cat, this is a stupid question, but does the cat actually have to eat that mouse or to get it, or can it just carry it around?
No, it has to eat it. Has to eat it. So once again, it can, the cat can get it just from the environment, okay? Just walking through and licking their paws. But if it's being spread via the critter, it actually has to eat the infected tissue of the critter, okay? So not just carry it around, yeah. Not necessarily the toy, yeah. Go ahead.
Can these parasites or any other ones that we're not talking about here, can they be contracted by eating raw or frozen raw food products that are out to main height?
Raw. Like if somebody's feeding a raw diet to their pet?
Right, yeah, raw or frozen raw.
Yeah, potentially. If they're in the tissues, yeah. I mean, it would be the same thing with us eating raw meat. We can get things from eating raw meat. And so, yeah, freezing does not necessarily kill a lot of parasites. So,
I ask because I take care of dogs from time to time that do that, and it's just,
yeah. Although, once again, keep in mind that a lot of them are species specific. Okay, so a lot of parasites have learned to live within certain species. And so once again, if it's like, let's say beef hamburger or something along that line, okay? Anything that could be in that is probably not infective. So yes, it could go through them, but it may not be infective to the dog. Does that make sense?
the possibility's there.
But yeah, there's always, depending on what you're dealing with. Yeah.
Thank you.
Yeah, so, okay, any other questions?
You've got that, something I did want to ask tonight, and since you got bird poop up there, now it's probably a good time. In the kennels, especially the kennels on the outside runs, we got sparrow colonies under there because they got, you know, there's some food, availability of food, straw,
Right.
torn up stubbies, all
Yeah.
the great nesting material. So they live in it, they got a roof over their heads, and we see some bird food there. But is there any, is that much of a concern? Is there anything that they could get?
There's not really any concern specifically, because once again, parasites of birds really aren't parasites of dogs and cats,
Yeah.
okay? And so once again, yes, if we check the fecal, gee, we might see like, okay, well, somebody was out there eating bird poop, okay? but it's still not a parasite for the dog or the cat. We still want to, and once again, as a maintenance thing, clean up the bird poop, okay? We don't want that building up. There are actually fungal infections, systemic fungal infections that are not part of tonight's presentation. I kind of thought about it. But those would actually be a bigger risk to us, okay? To the dogs as well, because there's stuff moving around, but the material has to build up quite a bit for those organisms to basically set up shop, get to an infective stage, that type of stuff. So it's high-rise buildings with the pigeons, which is why they put up the little metal things to keep pigeons away from air ducts. You would see outbreaks of like histoplasmosis because of that. All right, heartworms. These are spread by mosquitoes. And once again, the only way they can get them has to be bitten by a mosquito. Okay? And so this is a little mosquito who's getting a blood meal. See the fur? It took me a while to figure that one out. And several different kind of life stages. The babies are the microfilaria that are in infected dogs, and they're in circulation in the blood. And so sometimes in clinic, if we have a heartworm positive dog, we'll actually look at a drop of blood under the microscope to see if we can find them. And those are what's infective to the neck. So the mosquito takes a blood meal, sucks up one of those microfilaria, it goes through some life changes in the mosquito gut, and it goes over and bites the next dog, and basically now transmits the infective form to the dog. Okay? And then that infective form moves around in the tissues for a while, goes through some life stage changes, gets a little bit older, and finally ends up going to the pulmonary artery, which is the artery that's between the heart and the lungs, on the right side of the heart. And that's where it likes to set up shop. A dog, because they are the definitive host for heartworms, can literally get hundreds of heartworms in their pulmonary artery. Okay? They can live with heartworms for a long time because it has learned to live in the dog and not kill the dog until there's way too many of them. Okay? So it's good in a way that we can catch it and we can treat the dog. Okay? Some dogs, yes, do die from it. Eventually they die because of heart failure. Not necessarily the actual parasite itself. And like I said, that's why we do the preventative. You can't tell which mosquito out there is infected, which one isn't. And in reality, the ones who transmit it are the ones who really like dogs. They're dog mosquitoes, okay? They might bite us occasionally, but if you've ever walked a dog in an area high with mosquitoes, probably out here, and you watch those mosquitoes just go like this onto the dog, those are dog mosquitoes, okay? They preferentially like the dog, and they will bite them up here around the nose, the ear pinna, where the fur is thin, is where they're gonna take a blood meal. Okay, so that flea tick collar down here may not really do a whole lot for them. Okay. And several species of mosquitoes can actually transmit heartworms. Some of the ones down south, there is some talk of resistance to heartworm preventions. Once again, in warmer areas, they just have mosquitoes year-round. And a lot of dogs that are not on prevention, and so the loads get a lot more severe down there versus up here. But think about it, if we're bringing dogs up from the south, once again, we can be bringing those with them, okay? Or when another rescue group goes down to Texas and brings up a whole bunch to us, they may be bringing heartworm as well. And they may be ones that are more resistant to the products.
Yeah, I have a question about that. Is heartworm more common in dogs and cats?
Yes. So it's the same heartworm as you got. There's a little kitty up there in the corner. The cat's hearts are so small that the heartworm can't do a whole lot. They can usually get maybe one, possibly two in a big cat. And the vast majority of heartworm infections in cats are basically the third larval stage versus the fourth, which is the reproductive stage. So they never mature to adulthood. So cats never have microfilaria. Okay, the heartworms can't reproduce in there. And so to detect, it's harder to detect heartworm disease in cats. Usually it's getting both a positive antibody and a positive antigen test. But the antigen, once again, it's one heartworm, and it's for a uterine protein is what that antigen is testing for. So if it's a male heartworm in that cat, it's going to be negative, okay? Or if it hasn't matured enough to have a uterine protein, you might still get a negative. So it's not easy to diagnose. There's no treatment specifically for heartworm disease in cats where there is in dogs, because unfortunately the treatment is harsher on the cat. And if the heartworm dies too fast, it causes a very massive inflammatory reaction that the cat can't deal with. So in cats, we just have to support them. And because it's one heartworm and they usually live a set period of time, that just by supporting the cat, a lot of times that heartworm will slowly die and they'll clear their immune system will help fight it off and attack it and that type of stuff. Cats are pretty good about taking care of themselves sometimes in that instance. So yes, they can get infected. Yes, we do recommend heartworm prevention. Once again, the topicals now, Revolution, Revolution Plus, NexGard combo, those are all really good. You can do the oral, which is HeartGard, although I think it's going off the market because nobody buys it, and no cats really like it consistently. So yeah, take it once and then like, yeah, thanks. So it's not as effective. Cats are going more the topical way to prevent heartworms.
I have a follow-up to that question. So we have a cat that tested positive for heartworm, but then when they did the second test, I can't remember which is antibody and which is antigen, but then it came back negative. And so years later, the same thing happened. They're like, okay, I has heartworm, and they sent it in, and they said it was negative. So what does that mean?
So once again, it's probably like if it was on a screening, like a health panel, it was probably the antibody test that was run. Okay, and so your cat has antibodies against heartworm because it's been exposed and it's fought them off, probably. Because cats are exposed a lot. They get bit by mosquitoes as well. They get that microfilaria injected, and their immune system says, no thanks, we're gonna kill you now. And so they have antibodies against them, okay? But if the antigen test had turned positive as well, that would indicate there's still an actual heartworm, a more mature form in their system. Okay. What I usually do is, because you can't actually see them on ultrasound, and so if I have a cat that I'm suspicious, maybe we do have a positive or we're getting maybe some mixed results, is we'll take a peek with the ultrasound and see if we can see that little guy in the pulmonary artery or in the right atrium. So ultrasounds are very sensitive now, so they can pick up some things.
Rader, I didn't realize till a recent Facebook post that Mark is heartworm positive and hasn't been able to be cured from it with treatment. And he's kind of chunky, so he and I been running around the yard to exercise. Should I not be doing that as much because of his heartworm?
No, so Mark actually was heartworm positive when he came to us 3 years ago. He did successfully go through heartworm treatment at that time, and he was negative for 2 subsequent years. Every year that we tested him, and we made sure we sent home heartworm prevention every month for him to get. And we had continued to do that, and yes, when he came back to us, when we tested him for this year, he was positive. So somewhere between last year and this year, he missed some heartworm prevention, and somehow got infected. And once again, since we know that the immune system is part of fighting off heartworm disease, his immune system, with all of his allergies and with everything else, for some reason he can't seem to fight it off when he gets exposed. So I'm hoping he has a very, very small heartworm infection with only a couple heartworms in there. So technically, you know, he can be active. You know, I'm not too concerned about him going into heart failure because I know for the last he's been negative.
So if he's taking, will we continue to give him preventative? Will it help him to not grow, or will it kill? If he tested positive and he continues to take preventative, will it?
Preventative's doing two things. One, it's killing any microfilaria that could be in his system, so it's helping prevent him from spreading it to everybody else through the mosquito population here in the Whitestown area. The other is that we probably will put him on doxycycline. There's a bacteria that lives hand in hand with heartworm. They kind of have a little symbiotic relationship. And when you get rid of the bacteria, it weakens the heartworm to where then, yes, preventative may slowly kill that heartworm, because we're a little concerned to put him through the marloxamine, the harder treatment, a second time. He's already been through it. He's got skin issues. He's got health issues. He's a little bit older. He's 3 years older than he was the first time. So yes, we're talking about doing the slow kill method with him, but for that we really need to get him into a long-term foster home. But I know he's already been in a long-term foster home, but so, I mean, again, I'm getting back to
Is there a way, just along that same lines with Mark, I mean, is there a way to use his timeline of when we know he was clear, you know, that in that time frame, how far along the,
had to have been at least 6 months.
okay, yeah.
So it takes 6 months for basically from when they're injected from that mosquito with the infective form for it to go through the tissues and get to the heart and to be positive on a heartworm test is 6 months. So yeah, we get a fair amount. And this last month, my dog, do I need to come in and get my dog tested for heartworm? Not today. Call me in 6 months. We'll test and see. Because that's the length of time, okay? And once again, yes, we're gonna put them on preventative and just know that 6 months down the road, we could have a positive. Hopefully not. Yes, but for Mark, we do. So, and yes, for any heartworm positive test we get here, especially if we see microfilaria, we've got confirmation. We don't have to send it out to the lab for a second opinion. But like Mark didn't have microfilaria, so we sent his out and the lab confirmed. So we can do 2 different tests so that it's not just one test having a false positive to confirm an active or a true infection.
But if they don't have microfilaria, then the dog's not, you start treating, they're not really at risk of heart failure or stroke or anything. Is that true?
It's a little different because once again, the heart failure and that type of stuff is coming from the adults that are in the heart, okay, that are interfering with the heart function. But the microfilaria is what's infecting, the mosquitoes are picking up and taking to other dogs. Okay, so we don't want, even though everybody else is on monthly heartworm prevention, you know, if he's on preventative, then no microfilaria, we don't have to worry about him being a source for infecting other dogs. Okay. So, any other questions? All good questions. All right, this is the only gross picture. Okay, Parvo.
Was that blood?
Yeah, well, it's bloody vomit. Yes. So, all right, so this one I kind of set it up that I'll say comparing, contrasting dog and cat. Because they may get infected with the same viral class. There actually are different subgroups or different viruses, and they have different kind of diseases, but they're very similar. So, Parvo is a small DNA virus that likes rapidly dividing cells in order to replicate. So very important in understanding the disease process. It doesn't want slow cells, so it's not going to infect the skin, that's slow. Instead, it wants rapidly dividing, so the lining of the gut, those cells turn over constantly. Every day they're turning over, okay? Bone marrow, especially in a puppy or a kitten, oh, those are fast-growing cells. So that's what goes along with the signs that we see. Vomiting, diarrhea, anemia, because it's affecting that bone marrow, low white blood cell count, and then we get fever, lethargy, dehydration. It's really severe cases, unfortunately, we can lose them. So the double whammy for these viruses is because they're attacking the intestinal lining, they're causing ulcerations. That's where the blood's coming from, okay? That mucosal lining is getting disrupted. And that allows the bacteria that is normally in the intestinal tract to now have an opportunity to get into the body, okay? And then add to that, it's affecting the bone marrow. So now the normal response of the body is to make more white blood cells to fight off this infection. Oh, but hold on a second, the virus is in there killing those white blood cells and not allowing them to be released. And decreasing the numbers. So now they can't even respond to the viral infection, okay? So that's the double whammy with parvoviruses and why they get so sick. They actually die because of sepsis and dehydration, not the virus itself, okay? But the side effects of what the virus is causing, okay? And that's why treatment is a lot of supportive care. Fluids to correct and maintain the hydration, antibiotics for those secondary infections. Okay, we can't do anything for the virus. Okay, but secondary infections we can control. Nutrition, which actually getting nutrition into them helps heal the intestines, helps grow those little microvilli, the lining of the intestines. And then I mentioned the antibody therapy, which is what we did with the puppies. And actually, we've been doing it for a while. We just did it kind of the down and dirty way. We would pull blood from puppies that had recovered, spin down that blood, save the serum that had the antibodies in it, freeze it, and the next litter that came along, we'd pull that out of the freezer and thaw it and give it to the puppies that were infected so that we were instantly giving them antibodies that their body can't make to try to fight off the virus directly, okay? At least if we can buy them, 24, 48 hours with those antibodies so their body can start building up a response, then we would have more success with doing it. And that's what the Elanco product is geared for doing, is giving them antibodies to fight off that initial what their body can't make and get in there in the early stages to actually fight the virus and get it under control. We know that with testing, which is usually a fecal test, early on you can get a false negative because they're not shedding the virus. So it's in the intestinal tract, but it's not being shed yet, okay? So you can get a false negative from testing too early. If you wait and test too late, then you get a negative because that virus is now bound with antibody, okay? And the test is an antibody test, kind of. So the antibody's in the test, it's waiting for that virus to attach to it to say, here I am. So if it's already bound, it can't activate the test. So two ways that we can get a false negative, okay, when we're actually dealing with parvo. And that's why it's not uncommon. Oh, I got a negative today, I'm gonna test again tomorrow. Oh, there it is, okay? And confirm what we're dealing with, okay? So with a listed, we don't hear this very often, but we can see it. So puppies that are infected in utero or right after birth, so less than 6 weeks of age, can develop parvovirus myocarditis. So that's basically the virus has gotten into the heart muscle and it's attacking the heart. And these puppies will go into heart failure usually before 6 months of age, okay? Oftentimes it affects the entire litter. You may have early pup death, even before they're weaned. But those that do get weaned, we can still see it. And like I said, up to about 6 months of age. And we have had some of these that were adopted from other shelters at the clinic, and they look like perfectly healthy puppy, and then a month later they were in heart failure. And so we can see it. On cats, once again, same family, okay, of the parvovirus, so it's that similar small DNA virus, loves rapidly dividing cells, which in the cat, lymphoid tissue, the intestine, and bone marrow. Cats will have 3 different kind of clinical presentations. So subclinical are usually the adult cats. They may be off for a few days, might have a little diarrhea, basically just not feeling good, fever, but then they recover, okay? And once again, may not even notice that they were even sick at all, okay? The acute in young kittens and young adults, once again, they may be a little more sick, and once again have more diarrhea, be down for a few more days. Ones that we might do fluids, we might do antibiotics, those type of things with. And then the paracute, and these are the young kittens. And so these can be basically kittens that are 6 weeks or less, sometimes up to 8 weeks. They can be dead within 12 hours. So you've got what looks like a healthy, adorable kitten running around, playing, and 12 hours later it's dead. And you're like, what happened? This could be the cause, okay? No signs whatsoever. It can just be that fast. Cerebellar hypoplasia, these and blindness, these are the ones, the kitties that mom's infected while she's pregnant. Or like right at birth, kind of in that time frame, potentially right after they're born. And these are the bobblehead kitties. So the ones that can't maintain their balance, wide-based stance. It basically attacks the back part of the brain, the cerebellum, and that's what we need for balance. And it can also affect the optic nerve and the retina, and so they can end up being blind because of it. So a lot of them, if they're not severely affected, they still have good quality of life. They just always look like they've had 2 beers too many. But they learn how to get around and do everything they need to. I've seen 1 or 2 that were really severely affected. They couldn't even stand up. And those, it's probably more humane to let them go. Because they're not going to have quality of life.
With that, do they feel dizzy? I mean, do we know if they have that sensation of feeling dizzy with that, or is it just a little off balance?
I'm going to guess they wonder why their world is tilting, but they look at another cat going, why am I so weird? I don't. You know what I mean? I think they're probably like, no, I'm normal, you're the weird one. Because once again, they're cats, right?
Just wondering that causes discomfort or even like nausea,
Most of the time, no. So like I said, the worst one I've seen, they just could never stand up. And like I said, that can't stand up, you can't eat, can't. So this is just some general information about the viruses. They can live for a long time, okay, in the environment. Indoors, they like our climate-controlled environment, so they can live up to a year. So cleaning, disinfecting, using products like our rescue can shorten that time frame, but you can't see them, okay? So you think you've treated every spot, but you might not have, okay? And when you think of like in the chain link, all those little crevices, unless you straightened that all out and cleaned everything, there's probably some residual in there. Any little crevice, around the screws, around, you know what I mean? It can be there, and that's why even when facilities clean and disinfect, they can still end up with a dog catching or a puppy catching parvo from being in that cage. The longer time frame you can keep it open and not have anybody in there, over time that gets less and less, okay? Which is why some of the protocols that we put in after the parvos cases that we had, this is spread by their little feet, okay? Through the building, so once again, you know, watching where we take dogs that aren't vaccinated yet, to one, make sure they're not exposed to something, but also making sure that they're not potentially transmitting something, because they can start shedding it before they're clinical, okay? When I talked about them, you know, a lot of times we test and it's early because they haven't started shedding, but of course nobody follows the rules, so there's always somebody out there who's gonna shed it early, and so you just have to be aware of that. Bleach is actually a really good disinfectant, still is, has been, against parvoviruses. None of us like the smell of it. The peroxide cleaners, which is what the rescue is also one of the main ones. Some of the others that are out there, not as effective. They might have a label for it, but they need longer contact time. And anytime you have organic material, it's going to inactivate the disinfectant faster, and it may not kill the virus that's in there, okay? Which is why we talk about the salad board, okay? Because once again, there's going to be mud, there's going to be dirt that's been brought in, and so there's going to be some level of organic material, and so that provides it can deactivate the disinfectant before it can have enough contact time to kill everything. Okay? Outdoors, 5 months to 9 months. So once again, not as good in the outdoor environment, which is why we kind of said the 6 month, you know, potentially for dogs that are vaccinated, adult dogs, we don't have to abide by that, but unvaccinated dogs, we need to be careful. Okay? And yeah, it's always there, so it's everywhere. Don't think that, gee, I can walk my dog someplace and I'm not gonna get my dog exposed to it. No, it's everywhere. It's spread by raccoons, foxes, coyotes, you name it, they spread it, okay? So it's out there. Okay? So coronaviruses, a lot like parvo, okay? Clinical signs in dogs look just like parvo, but they get better. They don't get as sick. Okay? And so, once again, you can see, put kind of the ones that affect it, because there are a lot of coronaviruses. We all learned that with COVID. A lot of coronaviruses out there. And so dogs have been dealing with this for a long time, cats have as well. Oral fecal transmission, for dogs, all ages, all breeds, whereas with parvo, it's usually for younger dogs, but it can be an adult dog that hasn't been vaccinated or that is under-vaccinated. The incubation, 1 to 4 days, shedding the feces within 3 to 14 days, but up to 6 months. So once again, this is one that can be around for a while. Lots of asymptomatic shedders with this one, and acute diarrhea, vomiting. For really small puppies, dehydration, they can get pretty sick, but same thing, they spontaneously recover. So you look like you're a rock star, because no matter what you do, they're probably going to recover. Cats are a little different. So with cats, there's a group of 2 different types of enteric coronaviruses. And so same thing, can affect cats of any ages. And kittens are a little more susceptible. They get it, but they don't necessarily clear it. And so when I listed the type 1 and the type 2, gosh, cats are overachievers, they can get both of them at the same time. Most cats will clear the enteric form within 2 to 3 months, you know. They may only be symptomatic for a short period of time of vomiting, diarrhea, but 13% of them will hold on to that virus. It'll be in the tissues and it will just stay put. And it can stay put for years, okay? And that's these guys out here, okay? And it forms, and for some reason in their body, it can mutate and basically get around the immune system. Sometimes it sets off that immune system to like not only try to kill it, but kill everything around it. And that gives us our dry form and our wet form of feline infectious peritonitis. And because it's basically this, it causes a lot of inflammation of the blood vessels. There are some contributing factors. So once again, overcrowding, high density populations are they're gonna spread it around a lot more. Those cats are gonna be in more stress. Nutrition, they talk about how a lot of our diets are kind of low in the omega-6 and omega-3 fatty acids, and therefore they're pro-inflammatory instead of anti-inflammatory. And you look at those chubby kitties, and they're just waiting. They've got all that inflammation just waiting. And then genetics, and this is a big one. If anybody read the stories about the cats in Greece. So island of Greece, everybody's related to everybody, and they all have FIP. Just massive outbreak, FIP, and genetics, because now, based on the family, we talk about the immune system that's genetically based. So the virus has just like, oh, I can infect you, and you, and you, and you, because none of you guys have the immune system to stop me. So we know genetics plays a big role as to why some cats will come down with FIP and some of them don't. All of them in the same household. Okay? The bright news for FIP is that drugs that were made for us work on this. Okay, remdesivir. It was actually before we all found COVID. They had already made a drug that worked for cats in treating this. Okay, out at Cal State, and they were trying to get it to market, not having a lot of luck, and then a world pandemic, developed, and all of a sudden that information went over and said, let's form a treatment for people, because we know this works in cats, and we know it works in some other species, so let's see if it works in people, and my gosh, it does. But the bright news is it also works in cats. All we have to do is get the government to stop controlling it so that we can use it in cats and the prices can come down. There are countries that have, so the United Kingdom, Australia, Greece, they now allow the drugs that were made for treating COVID in people to be used conditionally for cats with FIP. And once again, very successful. And clears it. So, any questions there? Okay. So, for rabies on here, this has more to do because we isolate for anytime there's a bite, and specifically with dogs. So I just wanted to go back through rabies. So everybody, all warm-blooded animals are susceptible to rabies. Nobody's immune. But larger mammals are the ones that are the vectors. So the smaller ones usually die before they can transmit it. There are a lot of species difference in who's susceptible and who isn't, and I put it on there. You can see once again our cats can't make up their mind. Okay, so they're variable. Sometimes they're high, sometimes they're medium. But yes, they can. And they're the ones who like to go after this little guy right here. Okay? And this is our Indiana brown bat. That's who, since the 1980s, has been the highest population with rabies. So I put it just here. This is just kind of a map I pulled off the CDC. This is raccoon rabies. This is fox, not fox, skunk. This is skunk rabies. White is bat rabies, and then out here is, I think, the fox and coyote. So different. There are some different serovars. Okay, if you want to think of it that way. This is just for Indiana. So in the 1960s, that's when we started vaccinating against rabies. Okay. So prior to that, dogs and cats had a high level of exposure and potential transmission. Between 1960 and 88, it was skunks in the state of Indiana that had it. That's also when we started paying Ohio and Kentucky and some of the states around us to put out baits to vaccinate the wildlife so that they would stop bringing it into our state. Okay. And it works. It's actually been very effective in keeping rabies. You can see once again, there's the border right there, Ohio, Pennsylvania. Pennsylvania's not cooperating. So we did pretty good. So it's been bats since 1988 has been where the endemic population is. And in 2024, so just this year, just last month, was the first case of skunk rabies in 20 years detected in the state of Indiana, and that was down in southeast Indiana. And they will say there's a lot of stuff going down in that direction to find out where it came from, and once again try to keep that border with Kentucky a little tighter. Rabies out here. 2009 was a human case, so every year there's 1 or 2 cases out there. So
Is there anything being done to prevent it in bats?
there's not a whole lot that can because they're insect eaters. So most of the baits are things that they throw out into areas that the target population will eat. And so yeah, there's not a good way. And that's where, on the previous where I said aerosol, so caves, if anybody likes to go spelunking in caves and that type of stuff, there have been spelunkers that have been exposed to rabies because the cave population, the bats, it was just that heavy, it was, and the air, there's not good airflow and that type of stuff, and so that saliva is dripping down or getting into the air, and so the virus can get into the air. So that's where it said aerosol. It's not like a cat's going to hiss on you and you're going to get rabies. So any questions on that? So real quick on the respiratory, the takeaway on this is that there's a lot of things that go into respiratory diseases. It's not one specific thing. So originally I had these kind of divided between the viruses and bacteria, and I was like, no. They happen all together in one group, so we're going to talk about them as a group. So for cats, our primary players are herpes and calici. And the thing with herpes is that once you're infected, you get it for life. Okay, and cats get it for life. And so it can continue to show up during times of stress. So this nice healthy kitty comes into us, and then they're here for a few days, and next thing you know, they're sniffling, they're sneezing, they got runny eyes, they maybe don't feel so good, and that's because they probably have a reoccurrence of herpes. It was in their system, now they're stressed, it pops back up, okay? Likes to hang out in the trigeminal nerve, which is the one that's right up in here, goes to your eyes, so that's why they get squinty a lot of times, as well as in the respiratory epithelium. Primarily causes a lot of upper airway. Very rarely will this become a pneumonia unless the cat is immunosuppressed for some reason. Okay. So it does not like to live in the environment, which means we can kill it with regular disinfecting. So really just 18 hours or less is what it's going to live in the environment. Yep.
If it always lives in the cat once it has it, is it contagious to other cats?
It can be. So once again, because it can reoccur, they can do asymptomatic shedding sometimes. Usually they're going to be more symptomatic, but there are plenty of times where they're symptomatic and the viral load is so low that they're not really shedding significant numbers. But yeah, they can.
Are they shedding by sharing litter boxes or by water bowls and food bowls?
It's basically what's considered oral nasal conjunctival, so it's basically the sneezing, the saliva, those type of things is how it's spread. Calici is very similar. It's an RNA virus. Lots of different ones out there. The feline one can infect dogs, but dogs don't get very sick by it. Same oral nasal conjunctival transmission. But these guys, they can hold on to it for a while as well. So it can hang out in basically 25 to 75% of shelter cats, especially if they're co-housed. As far as those communal groups, they can all share it around and keep it going for a while. In the home environment, that kind of drops down to about 10% of cats will hold on to it. Otherwise, their body will clear it. These guys get oral lesions, so when you see me kind of open a cat's mouth and go, huh, calici, it's because they have oral ulcerations. And sometimes they can get them around their eyes, but in the mouth, and that's when they oftentimes stop eating. It has been linked to chronic stomatitis, so if you have any of those cats that have chronic red gums, and your vet keeps recommending dentals or let's have those teeth removed, sometimes it can be calici as the underlying cause, but they cannot consistently isolate it from every cat with stomatitis. So it may not be for every cat. And this is the one that can cause them to be more sick. So it can get down into the lungs and cause pneumonia. And then some kittens can actually get joints that are really painful and inflamed with it. So they usually do clear with supportive care. Can survive in the environment a little bit longer than herpes, but it is susceptible to most of the disinfectants. Mycoplasma, chlamydia, the bacterial infection usually is the goopy eyes. That can be part of the respiratory things in cats, which is why we use the terramycin. Sometimes we have to reach for azithromycin. Cats can get bordetella. Okay? We don't know if it really causes any significant disease, but it's been isolated from cats. So here we go, dogs. All these things go into respiratory. It's basically canine respiratory disease, or aka kennel cough, infectious tracheobronchitis, oral nasal transmission, direct contact, aerosol is how it spreads. So those dogs nose to nose, those dogs coughing across the aisleway, those are all. So a whole bunch of viruses, some of them that we vaccinate against, parainfluenza, adenovirus, distemper. We don't really, and influenza. We don't vaccinate against influenza here, but there are vaccines for it. But the rest of them really are vaccines. Well, they're not very effective, so we don't routinely do them. And then the bacterial agent, bordetella, which is what we're all familiar with, there is a vaccine for it. Keep in mind that vaccines against bacteria are not as effective as the ones against viruses. So they don't last as long. The body does not generate as strong of an immune system, which is why vaccines are not 100%. Mycoplasma and streptococcus, the others. So those are kind of the standard kennel cough, dry, harsh, non-productive. Push on the trachea, or pull them on the collar, and they start coughing a lot. You're probably dealing with that. Some of them can become more wet and productive, which would indicate maybe a pneumonia is developing, especially in unvaccinated dogs. They usually stop eating, they're lethargic, they act like sick dogs at that point. Okay. Supportive care, antibiotics, cough meds, and then if they are getting more sick, sometimes they have to be hospitalized. And there are times that the pneumonia is severe enough they have to be on oxygen, 24-hour care. Okay. And then yes, vaccines not 100%, but it can make it less severe, give them a chance and keep them out of the hospital. And this one, microsporium, I think I only did. Ringworm, there it is. Dogs and cats can get it. It's a fungal infection. Zoonotic, people can get it. Little skin lesions. It cannot penetrate the skin on its own. It requires some type of abrasion. Okay, so with cats, it's usually rubbing on something. Okay, which is why they oftentimes get it around their heads. Okay, same thing. Dogs might be head and neck because they're rubbing on things. Their feet because they're digging. Okay, that's how they get it. For us, it's same thing. We're working with them, and once again, we've rubbed. Maybe we have some dry skin, but the other is anybody who has elastic type around like their wrists or around their waistbands. It's a perfect place for a little infected hair to get. And because of that elastic, it's just rubbing on the skin, and so that's where people are like, oh, I'm just afraid I got a lesion there. So it's a lot of these, we can find it in asymptomatic animals, okay? We really only worry about it when they're symptomatic. Once again, you kind of see for the general population out there, maybe only 2% of skin lesions are actually going to be a fungal infection. But in shelter animals, for some reason, that seems to jump up to 10 to 20%, probably based on the life that where they came from, why they came into us. Zoonotic in that, yes, you petting the cat, you handling the cat, now you've got infected fur on you, you can get it. Goes away pretty easily for most people. And the top one is the fluorescence. So that's why we turn out the lights in clinic and bring out the blue light. Yeah, so we can see if it does that. There are other things that will fluoresce, so you can get false positives with that. And then just quick, as far as how do we prevent these things, vaccinations as much as we can vaccinate against, cleaning and disinfecting as much as we can. By picking up the poop is really important. Just cleaning every surface, very important. Washing dishes, not sharing dishes. And then when we do have illness, that we isolate. And to keep it confined and not allow it to get through the whole population. So even though that's a pain in the butt to have to deal with these protocols, but it does help. Okay? Any questions?
Can you just talk a little bit about ringworm and how it is or isn't different from the one you just previously talked about?
Microsporium is ringworm.
Oh, okay.
It is, yep. So technically, there's Microsporium canis is what we think of as ringworm.
Okay.
But there's a couple other classes of skin superficial fungal infections that are in the environment, especially dogs for burring their nose. And yet they're not zoonotic, but they all respond to antifungal treatment.
How long will the fungus stay in the home environment? Like in your own furniture? I mean, I've heard all kinds of different things.
Yeah, it's kind of variable. So there have been studies where researchers said, you know what, I took this and I put it in a container and I stuck it in the drawer and I pulled it out and put it on culture media a year later and it still grew. And I did it 2 years later and it still grew and on and on. But those were never exposed to heat. They were never exposed to, disinfectants, cleaning, you know what I mean? So actually in the home environment is probably not going to live that long, okay? And same thing, you're gonna do thorough cleaning, vacuum furniture, do whatever you can to decontaminate if you have a positive or a suspected ringworm. Yeah.
Me?
Uh-huh.
Okay. What can we do to prevent bringing it home from volunteering here?
Are you one of Dawn's volunteers?
Yeah.
It's really hard sometimes. I mean, sometimes we can see the lesions, okay, and kind of have a suspicion in that situation that this might be going on. But there are other times they're totally asymptomatic. They've got all their fur, they look cute and adorable, and then a week later it's like, what's this little little spot where they lost hair? And that's pretty common in cats, that they can do that. So it's hard. If you notice any, hairless spots, then you just bring it to Dawn's attention. She, send her a picture, she sends me a picture, and we kind of go from there. And if it's a multiple in one group, we're gonna say, guess what, here's your fungal, until we get a confirmed diagnosis, let's get it treated.
Is washing our hands enough after we're... Okay.
Yeah, once again, watch tight-fitting clothes. Take clothes off, throw them in the wash, and hand washing. Historically, where I would get it was working with more of the semi-feral cats. They would be in a cage, and I would have to coax them and reach in and kind of grab and pull them towards me so I could clean behind them and change out their their litter box and stuff, and lo and behold, you're like, oh, I feel crustiness behind their ear, and sure enough, one right here would develop, you know. And so I became the culture media for it. So it, you know, it's not that super easy to get it. Now, anybody who's immunocompromised, would increase that potential that you could. Same thing, they stay superficial, they're not gonna go systemic, it's not gonna get throughout your body, okay? But if somebody who's, somebody's immunocompromised, that might be a phone call to a doctor, that might be going out and getting a over-the-counter antifungal cream and start applying it,
We got a cat once, a long time ago, and didn't know he was covered in it, and I actually got pretty covered in it. And, yeah, and to my knowledge, I'm not immunocompromised, but I had it all over my face, and
I found out
And then I was
about it, and then we
allergic to
checked the cat, because there was no outward sign at all.
Like I said, there can be a lot of cats that don't show any clinical signs. There are some, and yes, I have, this was right after I graduated. I walked into an exam room, and this family, mom, couple daughters, and they're holding these 2 kittens, and all the girls are all like up in the air. And I almost screamed and walked out of the room because I could tell the kittens were covered in ringworm. And the rescue that they had gotten them from had said, oh, that's just a little skin infection because they lived in a dirty environment. And now that they're in your home, it'll get better. Yeah, they weren't happy. I wasn't happy because those kittens had been sleeping with the little girls in their bed. Yeah, we try very hard to identify things before they go into foster homes. But once again, some of them are asymptomatic. You can't see it until they finally tell us and show us that it's there. So,
our son was a baby, and he got it all over.
yeah. Once again, it's kind of bad. Got into the environment. Once again, you were probably carrying him.
Yeah.
Yeah.
The link one, he's so cute. Covered in ringworm.
Different kind of hair loss question. Going back to the flea and tick medication Revolution Plus, 2 of my most recent 3 cats, every time I treat them, they lose hair in like quarter size right where I apply it. It eventually goes back, but is that something that I need to be concerned about in terms of their being allergic to that medicine? Is there something different that you would recommend?
So yeah, they probably are having a little bit of a stick reaction to it, okay? They're having a reaction to the carrier, not to the actual drug, okay? Which cats will do, because cats are cats. So you could look and maybe talk with your vet about NexGard combo, okay? Especially if you need that flea and tick, so you need both of them. NexGard combo might be a nice choice. It's a little different, doesn't have quite that strong odor of that kind of alcohol-based to it, and it's depending on the size of the cat, they
20 pounds each. 20 pounds each.
Okay, well, it may not be a smaller amount then. The sales rep keeps coming in and telling me, but NexGard combo is a smaller amount for cats than Revolution Plus. I'm like, not necessarily when you have to add the small one and the large one together. Because Revolution Plus has a larger, like they go up to 22 pounds. And the NexGard combo, I think, goes up to 18. So then you have to add a small and a large together.
So these guys are both fully indoor, but my vet recommends, because I volunteer here, that I continue to treat them because I can bring them at home, which I'm fine with.
Yeah, you might even look at the Seresto collar then, if they'll wear collars and keep it on. You could also look at just advantage your frontline if they don't have a high risk. You know what I mean? So, and do, things as far as how do I protect not bringing stuff home from the shelter is leave clothes in the garage.
That's most of the dog collars, is what I do.
Yes, so leave clothes in the garage, change before you walk in the house, take socks off, shoes, that type of stuff, so that physically you're less likely to bring something in.
Thanks, Bob.
All right, anything else? All right, thank you guys.